Thanks, Toy. Well, as you know, February is Heart Month, and with Valentine's Day coming up, that's a good time to remind folks to take care of their hearts, and doctors like to remind us to pay close attention to our hearts at all times, but especially now, perhaps to get it checked. Dr. Christopher King with the Alabama Cardiovascular Group at Grandview Medical Center joins us now to talk about something that's related to this, and it's deep vein thrombosis, also known as DVT. Dr. King, good morning.
Good morning.
First of all, explain what deep vein thrombosis is.
So deep vein thrombosis is the development of a clot in the larger veins, particularly involving the legs, can involve the arms or the shoulders in that area, but predominantly it is occlusive clot that blocks the venous circulation from coming back to the heart through the large through the large vein system.
So when that happens, is that someone is going to have a heart attack, or what is happening there if that remains undetected?
So the danger, the life-threatening danger with a DVT is that a DVT can lead to something called a pulmonary thromboembolus. So if that clot detaches from where it's attached in the deep vein and goes through the heart into the lung, generally into the pulmonary artery, which is the conduit that blood goes from the heart to the lungs, it will block the flow into there, and it will cause people to develop chest pain or shortness of breath. With pulmonary embolus in the cardiology world, we look at there certainly are multiple deadly causes of chest pain, but there are three big ones in our world. Heart attacks, the first and the most well-known. Pulmonary embolus would be the second. And
all right, okay, try to talk. Yeah, I think try to talk with us again here. I think we've yeah, I'm gonna live TV, y'all know. All right, hang on one second. Okay, hold on. So doctor, we're having an issue here with we're gonna come back to you. Hang on one second, because this is important information. All right, can you hear me now?
I can hear you.
Okay, great. Okay, let's continue then. So you were saying, and now that leads me into my next question, and that is about symptoms. And I understand that maybe in half of these cases there are no symptoms?
So they can be silent, particularly in folks that may be hospitalized or have been bedbound for some time. The predominant symptom of the DVT is going to be leg pain or swelling in one leg more than the other. We tend to see this after long trips, after people have had orthopedic surgery. During times of infection, we have actually seen a huge increase in DVT and pulmonary emboli during COVID-19, as COVID-19's been a trigger for clot formation.
Are some people more susceptible than others, and what are the risk factors?
Absolutely. So some people are genetically predispositioned to having clots. It can also be related to weight, to if there's an underlying malignancy that's involved, infection that's going on. Again, there are several genetic components. There are also some anatomical considerations that make people more predisposed to clot. And someone who's had a clot previously is also more likely to develop a clot later on in life. How
are they usually discovered? Is it you're looking and that somebody's complaining about something and then you discover this?
So generally, two ways, so physical exam and patient history. So if we see a leg that's swollen asymmetrically, so in comparison to the opposite leg, it's much larger, that always triggers the thinking for DVT. Likewise, if we see someone who is developing chest pain that can't be explained as a heart attack or another cause, we always consider pulmonary embolus, and also sudden onset of shortness of breath, inability to breathe.
All right, final question for you. How is this treated when it is discovered?
So traditionally, we've treated with blood thinners, and that's been the mainstay for years. But there's there's a spectrum of how these are treated. The more serious ones, we have used clot busting medications on, which carry their own degree of danger. More recently and more exciting to us is that we've been able to physically extract these clots. Now we can take people to the catheterization lab just like we would for a heart catheterization, and a lot of times with these larger life-threatening clots, we can actually physically extract those using a catheter, very similar to how we approach a heart catheterization or do stents and things like that.
All right, Dr. Christopher King, we appreciate it. I know a lot of people watching now probably either know more about this than they want to because they're dealing with it, or they may need to look into it. So good information today. Thank you.
Well, thank you for having me.
All right.